When people think about cosmetic improvements, well, they usually think erasing wrinkles or weight loss, but your smile can be your best asset. And if you're not happy with your smile, the folks at Stoneridge Dental Care can help. Joining me today is Cynthia Levy and patient Eileen Troutman, and thank you to both of you for being here.
Thank you.
And Cynthia, really, a smile is something that people notice right off the bat when they meet you.
Absolutely. They say it's the window to your soul. It can light up a room. You know when people have a great smile and they show it. How it just lights up their face.
Yeah, and in this day and age, people notice it because there are so many things that can be done. Mm-hmm. So they expect straight teeth. They expect white teeth. Yes. And when that's not what they see, that's what they focus on as a negative.
True. Very true. Americans expect straight white teeth. Europeans sort of laugh at us. They call, they think we have big white teeth. That's what we like. We like those Hollywood smiles. We like it. It looks good on people. It makes you look good.
But you said Hollywood, but nowadays it's not just for Hollywood. And that's
it's not.
Everybody.
Everybody.
So tell me how you can get one of those great white smiles if you're not born with it, or if you've aged, it's changed a little bit.
Well, one of the best things that that's sort of new to our practice is something called 6-month smiles. And it's a short-term orthodontic program that we can actually take an adult, generally age 16 or over, and within 6 months, just move the teeth to give them a beautiful smile. It's not changing the bite. It's using a low-force technique, but it's sort of mini ortho, so to speak. And it's terrific. We have a lot of patients who have taken advantage of it, who love it.
In fact, Eileen is one that took advantage of it. Eileen, well, what do you think? Your teeth are white and straight, and they look beautiful.
Thank you. I love the outcome. It was easy to do, and I love the way they look.
Explain the process. What did you have to do in order to achieve the results you wanted?
I just had to show up when they told me to. They did all the adjustments, and
is it a clear plastic type thing, or is it a wire?
It was all white.
It was.
The brackets were white, and the wire was white, and the ring that they put around the brackets was white. So I actually had people who looked at me and said, "There's not something different, is there?" And there was, and I was wearing braces, and not everybody noticed.
So you can do this, what orthodontists used to do, like traditional orthodontics, but only on a shorter term now, Cynthia?
Yeah, I think it's more the traditional orthodontics. When you think of children who go in for ortho, or adults who have major issues with bite, that you're actually changing someone's bite. This is not changing a bite. This is just making things aesthetically pleasing, filling in spaces and gaps, which is what Eileen had. She had a lot of gaps in her teeth, and it was actually causing gum recession.
Well, can you do this on a shorter term basis without changing the bite? I mean,
Sure.
I would think that automatically moving teeth would change the bite.
Not necessarily, no.
And is it mostly for adults then? Because
For
if you're a
adults.
child, it's something different that they need.
Correct. It's generally age 16, 17 and above.
6 months is that all it takes?
It was.
Took a little bit longer than that, but basically 6 months from start to finish.
And I know we just had a patient who finished in 4 months.
Oh, wow.
So it can be very quick.
Now, what do you have to go through to maintain this? I mean, my kids wear retainers. Do you have to wear a retainer?
I have a permanent retainer both on the top and the bottom that I can't take out, which is probably a good thing for me.
So you can't remember or forget. There you go.
Exactly. And then I have a plastic retainer that I just wear at night.
And this is what most everybody does then to maintain that. Because our teeth are constantly shifting, aren't they, Cynthia, as we get older?
Yeah.
And Eileen is, well, I won't say your age, you're obviously an adult. Why does this work in adults and it doesn't work in kids?
Well, I think it's more that it's because we're just doing aesthetics and we're not looking to change bite. You need to have all your teeth in. It's not something where we're doing interceptive orthodontics, which is what a traditional orthodontics is.
And a good candidate would be anybody who is a certain age, and really you have to look at their teeth and make sure that this is going to work for them.
Oh,
otherwise,
of course.
They would have to go to a traditional orthodontist.
Of course, not everybody is a candidate for this. But if your teeth, a lot of what we have are adults who had orthodontics as children, and their teeth have shifted, and they've moved.
I know, And then you think to yourself, do I really want to go through that again?
Right. And because it's short term, and it's easy, and you really can't see it, it's very popular.
Well, it looks great, Eileen, and so you did go through it again only because you had to do it for such a short period of time, so good for you. And the results are great. Thank you. Nice to see both of you.
Thank you.